This section will look at sacrum and sternum. So the sacral foramen, well, first of all, this is the sacrum right there. Okay, so let's isolate it. There's an anterior view of sacrum and a lateral view and a posterior view. Okay, so the sacral foramen are these holes that you see, and on the back side, the posterior side, you see the holes, and on the anterior side, you're seeing the same holes just from the front side. Okay, the sacral foramen. Okay, the sacral canal is right there. This is a superior view. Okay, L5 would articulate here, and you're seeing the sacral canal. Some nerves will go through there. The cauda equina, we'll talk about that when we get to nervous system. Okay, sacral hiatus is right here. Sacral hiatus. Okay, the medial sacral crest, which is remnants of the spinous process. So right here, remember in infancy, the sacrum is individual segments like your spine vertebra. Then as we start reaching skeletal maturity, the sacrum, it fuses. Okay, it fuses, so you're going to see the remnants of the spinous process there on the sacrum. That's the medial sacral crest. Right there in the middle, the medial sacral crest. Okay, the sacral ala, which means wing, are these guys here, right there. And then if you change the view a little bit, you're seeing it there as well, the sacral ala on the back side. There it is right there. Okay, the sacral ala. The apex is down here. The inferior part of the apex, the base is this part. Okay, anything that's a broad, flat, like surface, that's the base. Anything that comes down to a point is the apex. Okay, you're also seeing the sacroiliac joint articulation area here. So this is the sacral part of sacroiliac. The ilium, which is not being shown, so let me back up. There's the ilium. Alright, so when you look closely, the sacrum articulates with the ilium there. So let's fade the others so you can hopefully see it. There it is there. That's the SI joint, or the sacroiliac joint. Okay, sternum. So I'm going to add the connective tissue so you can see the ribs, the costocartilage, and the sternocostal ligaments. Okay, on both sides, the sternocostal ligaments. Alright, the sternum has, I'm going to take them away. So this entire thing is the sternum, but we do break it down into three parts. We have the manubrium. Okay, there's the manubrium. The clavicle articulate with the manubrium. And then we have the sternal body. The sternal body. And then we have the xiphoid process, which is here. Okay, this part is the jugular notch. The jugular notch is on the manubrium. And then the sternal angle is right in here. Okay, it's where rib 2, let's add connective tissue. It's where rib 2 comes in. So here's rib 1. And there's rib 2. And it creates the sternal angle. Now that's an important structure with cardio because you want to assess the heart valves by auscultating the intercostal space. So there's intercostal space number 2, intercostal space number 2, and 3, 4, and 5. Okay, so that's something that you'll learn in ANP2 on auscultation of the heart, which means you're going to revisit the anatomy, the bones. You got to palpate, look for these areas to be able to accurately assess the heart.